Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Hi, and welcome to Fairfield Today. My name is Rick Schneider, Community Educator of the Fairhope Hospice and Palliative Care, home of the Pickering House, and if you might notice, there's the Pickering House. So we are in the front yard this morning, and joining me today for the show is Denise Bauer, our CEO. Denise, good to see you.
Good to see you, Rick.
Boy, it is nice outside here.
It's beautiful. It's supposed to be in the 90s all week.
Wow.
It's pretty.
And yeah, we are recording during the COVID situation, which could go on for quite a while, so we're staying at least 6 feet from the camera, so everybody's safe.
6 feet from each other.
Yeah, 6 feet from each other, and we have to adapt to all the rules like the whole country has. And Pickering House itself has a lot of restrictions. We've had to restrict our visiting not hours, but visiting, what's the word, quantity, amount of visitors. You know, we have restricted to 2 people in the building visiting at one time, so we do have a lot of restrictions in regard to the virus. And Denise, what are, I guess in a roundabout way, what are some of the restrictions we've had to endure?
Well, as you can see, we have our masks here. We've been wearing them, but it's kind of muffled for TV with these. But you know, there are a lot of restrictions. We follow all the Ohio Department of Health, the Center for Disease Control, as well as our local health department guidelines. So as this has unfolded over the last few months, you know, we've changed and revised our guidelines, you know, accordingly. Mm-hmm. You know, probably one of the biggest things that I've noticed is just our staff. You know, I mean, a lot of our staff have been working remotely, so we had to come up with some laptops that maybe the office staff had desktops, you know, for them to do that. All of our, like a lot of our nurses and our social workers and our chaplains, our spiritual care coordinators that were in the office maybe in the morning, or many of them are leaving from home or actually doing telehealth visits, which that we can talk about here in a little bit. It's a little different for hospice and palliative care. But you know, the other thing that, you know, it's just when we're in the office and we're here at our main office in Lancaster's at the Pickering House, and when we're here, and then of course the D.M. Turner Center, we have staff there, but it's just less staff in the building. Yeah. And then the thing I probably miss the most is our volunteers. You know, I mean, we have volunteers that it's almost like they work here full time, and we really miss them. And so if any of our volunteers are watching, you know, we're going to get you back here as soon as we can. We miss you. And you know, I mean, we've always appreciated everything they've done, but now even more. I mean, without them here, it's been difficult.
It's the old adage, you don't know what you had until you don't have it anymore, and we had to actually stop our volunteer program.
Right, and we kind of put a little hold on it just because, you know, with all the things that are going on, especially when this first came out, you know, just not knowing a lot about the virus and things like that. We just wanted to protect our staff and our volunteers, and we still do. But hopefully that's something that, you know, as the restrictions open up a little bit, we will be able to have our volunteers, you know, more in at least at the Pickering House and such. But, you know, we have volunteers that visit homes, patients in the Pickering House. They do various office duties for us, so they're really, really, really needed here.
Yeah, and it's affected our fundraising. The volunteers drive a couple of them, the Trash to Treasure sale. It's held in June. We couldn't have that just for the amount of people gathering.
Right,
and
can't do that.
It's become so popular. I mean, if it was like a yard sale, we could maybe get away with it, but it's popular.
You know, and people can really follow our website to find out some of the things that we're doing. But I know that they're looking at alternatives for the Trash to Treasure sale, and maybe even some of the volunteers may be hosting something, you know, maybe smaller gatherings to sell some of the items that we have, like at their homes or whatever. So we are looking at alternatives for that. Just because, you know, throughout the year we collect so many items, it's like we've got to get rid of some of them, you know. Yeah, and we do need the money to help with our children's grief services and such. So
absolutely,
you know, it's definitely something that we need.
That's what I say. You know, the fundraising is absolutely necessary for us, and to help the people on kind of the fringe of what Medicare does or doesn't do. with these fundraisers, we're allowed to add a little bit more than some hospices can because of the fundraising. And it is interesting that the Trash to Treasure, it's a year-round event, collecting, and Paul and Gwen, God love them, are two of our volunteers. He has a pole barn and it's coming out the rafters, and so we've had other places, and now there's no place to have the sale, or there's no venue to do it right now.
You know, so when you enter the Pickering house now, it's just different. When you enter the Pickering house, we have, usually we have a staff person at the front desk, and one of the guidelines, as many of you, if you enter other healthcare facilities, you know, that we're following the CDC guidelines with checking people's temperatures to make sure there's no fever, asking about symptoms that may be common with COVID-19. So we're looking at all that right as someone enters our building, and we're logging all that in. We do have masks. I do like the paper masks. They're a little more breathable. But our volunteers, once again, were wonderful and made us the cloth masks, which we also love, and I've used those as well. And I mean, I don't know what we would have done without those, because, and still, you know, as we provide these masks for our staff, those cloth masks are very, very helpful. And it's fun because when I entered the building, you know, I just see people with all the different, you know, types. It's like you can bring your personality out in your mask, right?
I wanted to get one with a handlebar mustache on.
I think that might fit you. I think that might fit you.
Add a little class to it. And, you know, we were talking before the show, they're actually becoming like an accessory. You know, that now you can get matching mask and shirt.
Oh, I know, people are matching them.
Yeah, you're not wearing that mask with that purse, are you?
Well, I got to tell you, when it first started, I hung mine from my rearview mirror. You know, no more fuzzy dice. I've got masks hanging. I mean, I just thought it was a good trend. Then I saw other people doing it and said, okay, well. I thought it was good, though.
That's a good idea.
It's creative.
What shows you're in the program. You know,
I'm
you have
with
the
it.
mask, and I'd like to. I was going to have my peach mask, and I didn't know if I should wear that with my tan one to kind of, you know.
Yeah, just kind of.
See the whole package.
Yeah, that's good.
You know, and make sure that. Of course, you want your shoes to match your mask. You don't want to go anywhere without.
Yeah. So, what is the etiquette? You know, we have to maybe talk about that.
Yeah, we'll have to work on that, and you know, you take it down to say hi, or I guess I take mine down when I eat. I've learned that.
Yeah.
You know, because it gets a little messy otherwise. But
yeah,
we're going to have a whole new show on mask etiquette.
I guess we will.
I never thought about that, but it is a part of life progressively now.
So one of the things that we do, you know, we'd love to have our volunteers help us with that front desk, because there's times where it's hard to staff that. But we screen everyone that enters the Pickering house, and then you know, we've always had visitation in the Pickering house. We've not stopped that.
Right.
But the thing is, just because of you know, the guidelines we have to follow, and we have to make sure that people have their appropriate PPE or personal protective equipment. So then that takes out of our stock for our staff. So that's the only reason we really did somewhat limit it. It's just because we want to make sure we have enough PPE, not only for our staff, but, you know, and visitors, but, you know, we just, you know, we have to be conservative in that way. So we allow 2 visitors at a time, but we really haven't limited that for, I mean, multiple family members can come through the day. But, you know, and part of that is, you know, for our staff to be able to, you know, handle the patient needs, and not having volunteers here, you know, that help so much. You know, it puts more burden on the staff, especially in off hours when less office people are here.
And we're not a nursing home or a hospital, so we have different parameters, different government requirements and rules, if you want to call it that. And it is at the end of life. I hear in different buildings, different situations. So sad when somebody's dying and the family can't get there. And in our case, many times, family members are coming from out of state. And to come in and say you can't stay, it just doesn't work.
So it's been good. We've been able to allow families in. The problem is sometimes it's that large family that all want to be in together, and it's just it's just very difficult. But we've had outside visitation as well as inside the building, and you know, we've been able to accommodate more people outside at times. So
I'm glad you mentioned that, because you know, one of the things that we do when this building was built, there's no steps, period. It's all ground level, so we can bring people outside, and they had a barbecue. I was here, I sometimes work the front desk. We have, you know, people screening, if you want to call it, and they were having a big barbecue out back for the person who's on service. So they just wheeled the bed out, and that way more people were there. Everybody maintained a distance, and
it's That's good.
It was just a nice event.
Well, and I think that's the advantage we have here, Rick, which has been very nice. Like you said, when we built the Pickering house, which we were both here then, remember those days?
Hard hat a little crooked.
Right. We actually did the show with a hard hat with E.C. Ballard. I remember that. But one of the things that, we made sure was that we had that area where families could get away and reflect and, just have that private space if they needed it. So I think we're very blessed to have the outside spaces we have. So we're on a patio right now in the front of the building, but we also have a patio in the back. We have a nice winding trail that leads to a shelter that overlooks the waterfall. Now,
We
who
got to
makes
do the
this
show
stuff
with
up,
the fall.
Yeah,
Yeah.
we'll have to do that sometime. But it is nice that we have the outside spaces for families to be able to visit and
Yeah.
things. So,
And that is an
good.
advantage when that way it does allow us to have more visitors at one time in an open space, following all the guidelines. But
Right, and we're following everything. We're trying to social distance that 6 feet apart, and so some of the things. So we've talked a lot about the Pickering house. We also have an area set up if we would have a COVID patient where those patients would be isolated from the rest of the patients, but that we haven't needed to utilize that at this time. People ask me, have you taken care of any COVID patients? And we have taken care of COVID people, mostly in patients' homes and in nursing facilities.
Yeah.
We've definitely provided that care. So, and our staff have the N95 masks and the isolation gowns and the face shields and the goggles and the masks and gloves, everything they need to be protected to do that. So, that was one of our challenges when we started this whole thing was, I think we were all a little unprepared as to what we actually needed as far as our protective equipment. And I know one of our staff, Becky Hinkle, full-time, did nothing but make phone calls for the first month or two, just trying to get us as much as we could to be able to meet those needs.
Wow. And, it's interesting. When you said we have had COVID-19 patients on service, one of the things that's always impressed me about Fairhope, and I've been here for a while, is that 6 months or less is the only requirement. We've had other people with contagious diseases,
Yes.
Unpopular diseases. We've had all different situations, and all we do is adapt to them. And it just
Right.
still impresses me.
Well, in all ages too. That's the other thing. We take care of children as well as adults, which not all hospices do that. But we have physicians and staff that are comfortable with that, and Children's Hospital does a great job of working with us to provide education as we need it.
I remember we had a little 2-year-old, and she she didn't look sick, and that was the hard part. Beautiful brown hair, and her mom would not put her down, and so we brought her into the Pickering house, and volunteers, married couples came in, a mom and a dad, or grandma, grandpa. We had couples come in every 2 hours round the clock, and that way the mom could sleep in the room with her baby, but she had somebody watching them. And
Right.
it was just incredible. And well, tell you what, we're going to have to take a short break. We have more information and more stories to talk about COVID-19. So thank you for watching. Remember to celebrate life, and we will be right back.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our 2 locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. And we came across this town called Lancaster, and we fell in love with the downtown area where the fountain is and the memorials and the flags and all this stuff. And we looked around and I said, there's our bank right there.
There's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with the community bank where you live.
Fairfield Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here, they're conversant, customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC, Equal Housing Lender.
Dagger Law has been part of the Lancaster community for more than 110 years. This is where we live and work. You'll see us at festivals, sporting events, and all around town. We consider our clients as friends, and we walk alongside you through challenging times. Whether you're a growing business, a changing family, facing litigation, planning your future, or dealing with land issues, we're right here. We are local. We are trusted. We are experienced. Dagger Law.
Hi, welcome back. My name is Rick Schneider, community educator with Fairhope Hospice and Palliative Care, home of the Pickering House. And joining me still, I caught her before she ran away, Denise Bauer, our CEO. And I say that because you're always busy, Denise.
Oh,
You look relaxed, but there's always something going on.
There's always something, and especially these last few months, it's been busy.
Yep, and on the first half of the show, we have been talking about the COVID-19 and how we've adapted to it, how everybody's adapted to it, and which is business as usual for us.
Well, we really try to make these families and patients comfortable. Even in the midst of this, we know there's this extra added stress, but we're here to provide that care and give that family time together. And so it's just been really important for us to focus on our mission and what we can do to help people, not what we can't do at this time.
That is a good point. We deal with people in the crisis of their life. The family is in a crisis, and people are becoming understandably upset because of the national pandemic. But we are still a calming effect. We didn't get excited. What do we have to do? We'll deal with it and we'll cope with it and we'll move on. And I think just subconsciously when people come in here, we're understanding of what they're saying. We understand being in a crisis. And we just adapted to this. We still give the excellent service we do, and we just do what has to be done.
Yeah. So, we've talked a lot about the Pickering House, but we have provided care in the homes. So one of the things that is unique to this situation, well, there's a couple things actually, but one that really stands out the most, when the president declared a state of emergency for the country, it allowed Medicare, CMS, to open up some waivers for various parts of healthcare. And the way that really impacted hospice and palliative care is that it allows us now, which we were not permitted to do, was to provide telehealth services and that telemedicine. Okay. So many of you that are watching may have had telemedicine visits with your providers. And so that's allowed us to do that as well. So we are still making visits. And I didn't mention our wonderful aides when I was talking about the various people on the team that have been seeing these COVID patients, and all of our patients. But the aides typically, a lot of the facilities, and especially some of the people in our homes are allowing the aides to come in and provide personal care and do some things. But we've had to make some adjustments. If we have someone visiting, whether it be in the Pickering House or if one of our staff are in a patient's home, it's making sure that the staff spend that 6-foot distance if they can. We can do, we're going to have to touch and do hands-on assessments with our patients and provide personal care and other types of care. But then when we're done with that, maybe stand across the room so that we have that distance to protect each other, us protect the patient, even though we have all of our protective equipment on, but to also, provide protection for us. So that's probably been something a little unusual for our patients, is that distancing. And, people want to be touched, and so we want to provide that care, but we also want to protect everyone as well. So it's a fine line. And our nurses and our social workers, chaplains, them that are doing some of the telehealth visits, our nurse practitioners are also doing that with palliative care, is that, sometimes they don't feel that connectedness because we're so connected to our patients. But I think we're getting through that, and we're visiting as often as we can. And many of you have heard on the news, I'm sure, about the nursing homes and assisted livings, the ECFs, that have had problems and, had to have severe restrictions, to protect their clients and their patients. So we honor that. So it's been, you know, the nurses and the staff at the facilities have worked really well with us so that we can still provide hospice and palliative care. So when we can make a visit, we do, and otherwise it's telehealth and really staying connected with the families. And the grief team, our social work team, have really stepped up in providing that emotional support and things that the families need. Because, you know, their distance, they can't sometimes go into facilities, and it's been difficult for them.
Well, that's the, I don't know if you want to call it an irony of this whole situation. The at the core of it, you can't touch or be close, and that's what people need in a crisis, to touch and be close. And that's, I think, what's kind of rippling subconsciously is this whole problem. We want to hug somebody. It's going to be okay. Well, you know, hug me from 6 feet away.
Well, it was funny. I walked in, and I had one of the nurses, I hadn't seen her for a while. And she just walked up to me. She goes, "Virtual hug," you know. So I'm like, yeah.
Think positive thoughts.
Well, one day I remember it was last week. Somebody just walked up. They just weren't thinking. We all had our masks on and things, but it's just, you know, it's hard for people.
It is an impulse, and it's you can't legislate that need, you know, to hug, and that has been a hard part.
But we are doing everything we can. You know, I've got my little hand sanitizer. I think we should have all bought stock in this because, you know, it's. And, you know, washing our hands and providing all that as well.
Yeah, we're the cleanest country in the world now.
I think
mean,
so.
Every 10 minutes we're washing or we're doing something. And I think there are going to be some long-term spin-offs, and I think sanitizers is one of them. So there's a little tip from Fairhope: buy stock.
Yeah.
Things are changing, but for the good.
Yeah. And you know, the thing is, we want people to feel that we're providing that safe care and you know, taking care of their needs, but also in a safe manner. So some of these restrictions and things we've put into place, you know, have been for that reason. One of the things we've asked people to do is to limit the amount of family in the room when we're visiting the patient in the home, if possible, which is different. I mean, it's not mandated, but we just request it so that we can, you know, have that limited risk of exposure for both sides. And then, you know, of course, you know, our nurses and our staff, our social workers, chaplains, aides, everyone's taken in their hand sanitizers and things. But, you know, I think, and then really limiting the children that we're involving in that care.
Yeah.
You know, one of the recommendations is that, you know, we limit those under 18 even with visitation. And so I know that, you know, we've kind of gone around and tried to accommodate that, but not to have children in our building it's been different for us, especially at the Pickering house.
We love to have the kids in there. You know, the nice thing about the Pickering house is, like mentioned before, we have a little bit different set of rules in a nursing home or a hospital. And many of the other hospices use rooms, you know, in hospitals or in nursing homes, and it gets a little cumbersome.
Yes, it does.
Where we have a different set of rules, which is...
We have our own building, so it makes it nice.
More accommodating,
It is.
In a time of crisis, it's good.
Right, and really there wasn't any limits put on the amount of visitors we could have like other places. So, and then, you know, we work with all the local hospitals that have been providing care, especially at Fairfield Medical Center and Hocking Valley Community Hospital. And so that's been nice that we've been able to do that. And they've been as accommodating as they can when our patients are in there and they need that end-of-life visitation from their families. So we applaud all of our partners in the community and healthcare providers that they've been as accommodating, I think, as they can for that.
That is a good sign that, you know, sometimes we can have competitors in this business, if you want to call it that. Everybody's working together for the common good.
Yeah,
you know, it's just amazing. And I hope we get our volunteers back at some point.
I do too.
You know, we have the No One Dies Alone program, which is all volunteer driven, and because of the restrictions, they can't go into the nursing homes where many of the veterans who are passing are, you know, and so all the volunteer programs have stopped.
Yeah. Well, they're on hold for now, and we'll get back to them, you know, as many as we can. You know, what we can do with, you know, of course, our Zoom, we're doing a lot of Zoom meetings or you know, just conference calling and video conferencing and things like that, like everyone else is. And so that's kind of been nice. I mean, we've realized that there's some things we can accomplish, you know, virtually. So I think it's, you know, it may change our new normal a little bit where maybe some people are working more remotely. You know, so.
With Zoom meetings were always fun when I was there, and I still do the Zoom meetings for the marketing. And Rick, are you there? Yeah, we don't see you. Well, I can't get my video to work.
Can't get the video to work.
Rick, we can see you. We can't hear you. Unmute it, Rick. I go, oh, okay. So at least it kind of breaks the ice when we're getting things going. But, you know, there are some advantages of that. Maybe, you know, Once in a while have a video meeting if the weather's bad. You know, like in the winter we can do that.
Yeah, absolutely.
And you know, one of the things they were talking about, the spin-off with this, is that working at home, there's always a psychology of going to work. You know, if you're a grandma, a mom, or whatever, you go to work, become a nurse or a social worker or a chaplain. But now if you're at home, there's no transition going from one to the other. And he said it's causing some, I guess, I won't say a crisis, but a little bit of adjusting, you know, where you can't turn off being an employee to becoming a family member. So that's one of the little things about working.
Well, I couldn't
at
turn
home.
off work. I mean, when I was doing a little more from home, is, you know, sometimes, especially trying to get these protocols in place, stay on top of the regulations. We're talking 12, 13-hour days, and it's like, and then it just blends into your, okay, it's time to get ready to go to bed now. You know, it's like working day and night, and we do that sometimes anyway, but it seemed to be even more from home, you know, where I just didn't stop working. You know, it's just, my husband's like, oh, you could take a break for lunch. I'm like, I'm just really too busy. You know, it's just crazy. But yeah, and it is hard, especially, you know I have a family member that has been required to work from home. My sister's in Dallas, and she hates it. She likes being around people, and so it's been really difficult. So it is hard for some people, but one of the things that we've been able to do is to have our social work team, our grief team, and people have reached out to help our staff with those issues and the feelings of isolation and the change and things. So I think that's been helpful.
Well, that's been interesting that with our staff, we can help each other internally, and we do get emails to all the employees, positive thinking, ways to cope with different situations. We as well are having the same problems as everybody else. And it is nice to be here because we have every kind of option you need. Somebody who can help somebody somewhere is right here, you know.
Right.
So,
so I mean, we've done more cleaning, I guess. That's another thing that we've always cleaned a lot. I mean, our housekeepers take 2 hours to clean a room in the Pickering house between patients.
Wow.
With all the steps, and I've never seen that in healthcare, but we're very thorough on a regular basis. So the room cleaning hasn't had to really step up because we were already, I mean, 2 hours is a long time.
We were already ahead of the game.
Yeah, we were. But, you know, just that other cleaning around the building, you know, and those kind of things has taken place. And, you know, the staff, you know, there were, especially when this started, there were staff or there were families that, you know, they weren't sure if they wanted someone in their home. And so the staff, you know, took on other duties. And some of that was, you know, trying to make sure everything was kept clean and things. So people have really stepped up and done a lot of other things that they don't normally do. And so we applaud our staff, you know, for all that as well.
Well, and that's a good point. You know, we always had volunteers at the front desk.
Yeah, that's
but
been
since
different.
we've had to eliminate our paid staff is filling in at the front desk, and it's good for them to see the visitors coming in.
Absolutely.
Because many of maybe our home staff doesn't get to experience that, or personnel administration might not get to see that. Now everybody is somewhat at one point or another at the front desk. They see the visitors coming in and hear the stories.
Yeah, and that is nice. You often mention that people don't get to hear the good stories and the thank yous, and I think by our staff sitting, like you said, at the front desk, they get a little more of that.
Yeah, it's. I was talking to a man at one of our memorial services one time, and he was talking about the change of the clocks. We had a memorial service, and he said he woke up in the middle of the night and looked at the clock. It was like 3:55, and he went to sleep, and he woke up again, and he got to think, wait a minute, my wife died at 4:55, and we just changed the clock, so it's actually 3:55. And he said, my wife was waking me up to tell me it was the anniversary, and they must have daylight savings in heaven. So. But that you hear that from hearing the meeting the general public. Yeah. So I'll tell you what, Denise, I've learned quite a lot. I'll have to watch the show myself and take some notes. You know, we covered a lot of ground. So we wish everybody health, happiness, clean, wash your hands, wear your mask, keep 6 feet apart, and at some point this is all going to be over. Everything's going to be okay. So Denise, thank you for joining me today.
Thank you for having me. I appreciate it.
Good time. Thank you everybody for watching, and remember, celebrate life.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.